And I must
Recording
say
in
that
progress.
thanks to our CFO, who is, I think, on 18 months now or so, who is the strictest CFO I've ever experienced in my life. And thanks to her, as an accountant, she knows what she's doing. We are happy. Our ARC, they are all CAs, they know what they're doing. But above all, our CEO, Dr. Matotoka, who's been very, very and intentional and focused that this is a new CGE. We have turned the corner. We are not going to compromise. So we are at that place. We have taken our rightful place as a member of C9s. In fact, the CGE is now the chair of the Forum of Institutions Supporting Democracy. There's 11 members. We are chairing that for the next 2 years. The CGE will be chairing that. Both at principal level with the PPAG and everyone, and at provincial level with all the C9s that solid ground. With those few words, Chair, I would like to say, maybe if you are ready, the CEO can go ahead with our two reports. I don't know which one you want to start, the teenage pregnancy one, or we go through the reports and then the teenage pregnancy.
Chairperson, it's really up to you. We'll take all your presentations at the same time, and thereafter members will engage. So it's for you to decide how you want to present them. Thank you.
Okay, no, thank you very much, Chair. Dr. Matotoka, over to you. Please, let's start with the organizational stuff, because that's where I think a lot of the things that have been done, we will be able to answer them. And then after Dr. Matotoka, CFO, you will come in, and then we will go to the teenage pregnancy one, just so that the organization is actually interrogated on time. Thank you.
Thank you, Chairperson. Good morning to members of Parliament, Chairperson, and commissioners and colleagues. I will be presenting the Q2 and Q3 reports, and thereafter we'll touch on the teenage pregnancy report that we compiled and publicized in the past years. Chairperson, just confirm if you can see my slides.
We can. They are clear. You can proceed.
Thank you, Chairperson. I will skip the mandate, Chairperson. The first question, Chair, that was asked in the guiding briefing note was that we highlight the challenges or the targets that were achieved and those that were not achieved, and what are the mitigating factors for us to address those deficiencies. So the next slide, Chairperson, the one that is reflecting, it's broadly reflecting what we achieved and have not achieved. And what will follow thereafter would be a detailed presentation around those specific targets and what led to their non-achievement. So on Q1, on 1.1, we had a target in terms of Q1, 2, and 3 in terms of legislative submissions. We were not able to achieve the Q1 as previously reported, but the deficiency was covered in Q2. So in Q2 and Q3, in as far as 1.1, Chairperson, we were able to meet our targets. Similar to 1.2 in terms of strategic engagements with the arm of government and the private sector, as well as the government chairperson on Q1, 2, and 3, we were able to meet the target. So we have no challenges there, as well as 1.3 and 1.4. Chairs, I've said I'm going detailed regarding the specifics. So at overall, at Q1, we have a 75% achievement due to the deficiency that was highlighted in 1.1. And then in terms of Q2, we have 100% achievement, and Q3, also 100% achievement in terms of strategic objective number 1. And then in as far as strategic objective number 2, for all 3 quarters, Chair, we have met all our targets. So it's 100% throughout. And then in terms of SO3, Again, Chair, here we did not experience any challenges. We were able to meet all our targets in that regard. We experienced a bit of challenge in terms of outcome for Chairperson, in terms of the achievement, both in quarter one as well as in quarter two. And this is largely on 4.1 regarding the development of a corporate organizational strategy, as well as the implementation of the change management plan. Now, one of the causes that led to that, Chair, is that we needed to get a service provider to come and assist us with the development of the strategy. And unfortunately, as we issued our RFQs, we were not able to get favorable bidders in as far as this issue is concerned. And this is why we're unable to achieve 4.1. And 4.1, of course, is linked to the change management plan that is linked to the business model. So we wanted to make sure that there is that synergy and interlink between the corporate organizational strategy as well as the change management plan. So we were not able to achieve that. But those deficiencies that we could not achieve in quarter two were subsequently addressed in quarter three, and we are confident that by the end of quarter four, we would be in a position to report that we were able to meet our targets in that regard. So on average, in terms of Q1, we're at 93%, and in Q2, we're at 79%, and at quarter three, all our targets were met, therefore it's 100%. So what follows, Chair, now I'll be presenting in terms of the specific details now so that members can have a full understanding. So in terms of outcome one, Chair, it's on the number of submissions on the legislative frameworks. We have done so in quarter one, rather in quarter two, wherein we made 10 legislative submissions. So this was 10 because the 5 could not be done in quarter two. So we consolidated this in quarter two. So in quarter two, we made a total of 10 submissions. This included inputs to the national standards on arrest and treatment of arrested persons until such persons are handed over to a community service commander, draft bylaw on township economies, local government municipal structures amendment bill, the local government laws amendment bill, the Paris Agreement, particularly on gender mainstreaming and the NDC enhancement in South Africa, the Judicial Amendment Bill, the UN's Committee on Child's Rights to Access to Justice, the UN Human Rights Council on the Rights of Disabled Persons, regulations on the Traditional Health and Practitioners Act, as well as the investigation into the minimum wage. So we were able to cover what we could not achieve in quarter one, and we were able to do that in quarter two. What is important here, Chairperson, was the need for us to start to monitor the inputs that we are making and to what extent are these inputs considered in the final legislation when it's passed into law. And we were happy to see that one of the past legislation, that is the Customary Initiation Act of 2021, we have made substantive inputs rather in terms of a number of areas that needed to be considered there. Issues around virginity testing, the cohesion and the coerce of such a practice, and we're happy that most of our inputs in terms of legislative framework were thus considered. So we are embarking on a process to monitor all these legislative submissions. How are they considered? Because we are of the view that should they be passed without consideration on the gender blindness of some of these bills, we are likely going to exclude other race groups or persons unfairly on the basis of their gender, race, or disability. So that is the process that we have just embarked on now. And then in terms of 1.2, we had a target in terms of internal stakeholder engagement. We had a target in terms of internal engagement. We were able to have that with the CGE community internally so that we can understand what are the pertinent issues that currently in provinces as well as the national offices. And it was clear that there is a need for us to attend and address issues in the higher education sector. So we're able to do this in quarter two. And in quarter three, I'll be explaining what have we done subsequent to these discussions. Chairperson, we held 2 investigative hearings, both in the Eastern Cape as well as the Mpumalanga province. In the Eastern Cape, we focus on the Tutuzela Care Centers, and we held a hearing on the 18th of September, wherein we have called a number of duty bearers to come and explain the challenges that they experience in as far as Tutuzela Care Centers are concerned. And we were able to have meaningful engagement and made progressive recommendations that will ensure the efficiency of the Tutuzela Care Centers in the Eastern Cape. And this is very critical because we, in the year before, in 2022-2023, we did our inspection in Locos through the commissioners to inspect the efficiency of the Tutuzela care centers, and they were able to pick up some of this gap. So this was now a build-up on what the commissioners did in the financial year 2022-2023 and 2023-2024 respectively. We've held hearings in Mpumalanga as well on the withdrawal and delay of sexual offences matters. This is one of the areas where we're responding. One of the challenges, as we know, in the country around GBV, we wanted to understand what are these factors that leads to the withdrawal of these cases, and is it justifiable, and what can be done. And this hearing, Chairperson, revealed a lot to us regarding some of the challenges that are experienced, for example, in Mpumalanga, particularly the nearby borders, where if an accused person is facing such a charge, at times they are able to move from the country to the nearby countries, and they're not able to be located. In some instances, it was reported that the witnesses themselves, they may be in the nearby countries, and therefore they could not be allocated. So these are some at high level reasons that were advanced by the National Prosecuting Authority as well as the South African Police Service as part of the contributing factors leading to the withdrawal of cases. What we have done with the provincial manager, chairperson, was that then there is a need also to now have a broader stakeholder engagement to call all these key or duty bearers to understand how we can now deal with this. So post this hearing, we held another stakeholder engagement where the judiciary itself was called to understand the paucity of judicial officers in the Mpumalanga division, because that was also one of the reasons that were advanced by the NPA, as well as the social development department, to understand what psychosocial support are they providing to victims of sexual offenses. So this is a build-up investigation which we will release our report by the end of this financial year. And then in terms of complaints handling, we had targeted 80% compliance with our CG complaints manual. We were able to achieve that without any challenges. In terms of 2.1, that is outcome 2, we had targeted 18 gender mainstreaming interactions promoted and monitored for both public and the private sector. We don't have any variance there. We were able to achieve our targets. In terms of 2.2, we had targeted 27 develop gender equality education and information initiatives for public dissemination, both in the public and the private sector. We were able to achieve 69 of those. So there's a 42 positive variance there. And one of the contributing factors there, Chairperson, is that in Q2, we were launching the two reports, the reports on access to communal land, as well as state of maternity wards in the Eastern Cape. And further to that, we held a conference on the 30 years of gender equality in South Africa. So because of those initiatives, we saw the increase in terms of the request for dissemination of information. Thus, we had this positive variance. Equally, in terms of 2.3, we had targeted 9 outreach initiatives using radio to educate and engage communities about the mandate of the CGE. This is one of our core mandates, Chairperson, and we believe the usage of radios continues to be one of the progressive ways to ensure that those that are in the deep rural areas are still able to access the information and the mandate of the CGE and its services accordingly. As such, we had a positive variance of 18, and we did about 27 of those. Again, we could not turn down some of these invitations because this is key to our mandate, and we did not spend any monies in terms of that. This was just invitations. We had targeted 9 gender and development training content and programs for both the private and the public sector. We overachieved that with 11. So again, there's a positive variance in that regard. We had targeted 27 content development initiatives for communication platforms using technologies to amplify our mandate. We had a positive variance of 4, thus we did 31 of those initiatives. Therefore, there's a positive variance. Similarly, on 2.6, our target was to have 9 stakeholder engagement coordinated to discuss critical gender issues in provinces. We did 12 of those. Therefore, there's again that positive variance of 3 during that quarter. In terms of outcome 3, starting at 3.1, our target was to issue letters to gatekeepers in terms of our research studies and do data collection as per the concept note. We did not experience challenges there. We were able to disseminate the necessary letters to the stakeholders for us to collect the data and interview the relevant persons there. In terms of the 3.2, which pertains to one report on the country's compliance with regional and international instrument. Chairperson would recall that in terms of the CG Act, we are obligated to monitor the international instrument, and as far as the participation of the country is concerned, especially with those international instruments that we have signed and ratified. So during Q2, we did data collection, particularly on the CEDAW, and we've started with the data analysis, so there's no variance there. We had targeted one policy dialogue during the Q2. This was done on the 30th of September, and this was based on when we're assessing the effectiveness of GFPs in South Africa and the government's response to the CG's findings and recommendations. In that policy dialogue, Chair, it became very much clear that the GFPs are largely still based in lower level positions, and therefore they are unable to influence decisions in the public sector when it comes to gender-related issues. The issues around the inadequate budgets set aside to support the work of GFPs was also flagged in the policy dialogue, and it became clear that there is a need by the public sector to respond expeditiously to address this efficiency, because issues of gender are not prioritized in the public sector, because those that are tasked with this responsibility are based in lower level decision positions. And then in terms of 2 engagements to share research outputs with various stakeholders, we have a positive variance there where we held 2 those engagements during Q2. And then in terms of research reports for monitoring and publication on our communication platforms, we don't have any variance there. We have used infographics, CG website, our YouTube channel to ensure that our work is publicized in those platforms. In terms of outcome 4, we had a target of a conceptualization of a corporate organizational strategy, as well as the draft corporate organizational strategy. As indicated, Chair, we needed a service provider to also help us here in terms of the draft, but the concept itself was done in terms of Q2. As I'll report later in Q3 that this was subsequently addressed, and we are in the process of finalizing that corporate organizational strategy that will be linked to the business model of the CGE. We did not have challenges in terms of management meetings, so we met all our meetings accordingly. So 4.3 pertains to the change management plan. This is what I was referring to, linked to 4.1, that we need to make sure that corporate strategy is linked to the change management plan pertaining to the business model. In terms of the level of financial expenditures, the CFO will touch on these presentations, Chair, in terms of how we've performed in terms of the expenditures and planned improvement initiatives. The target also on the audit action plan, the CFO will touch on that. Suffice to say that we do have an audit action plan to respond to all the audit findings that have been flagged by the AG as well as internal audit, and we have a clear plan on a quarterly basis to reduce and address some of those audit findings. We have one progress report on compliance universe plan. This report details all the legislative prescripts that the CGE has to comply with. And so far, Chair, we were able to determine those that we needed to comply with, and those that we're not compliant with, we've started to embark on processes to ensure that there is full compliance. And as a result, we were assessed by the Department of Labor during Q2 to determine our extent of compliance with the Employment Equity Act. We were also assessed by the information regulator to determine how we have complied with the prior legislation. So thus far, the reports from the Department of Employment and Labor has been positive. Our employment equity plan was approved. Therefore, all the recruitments that we're embarking on are informed by that employment equity plan. In as far as the information regulator is concerned, there was only one area that we needed to correct. We are currently at 96 compliance with the prior legislation. We just needed to include a clause that highlights processes to be followed, pardon me, by the CGE if an external person outside the country seeks information to the Commission. We just needed to include that clause in our manual so that we can be fully compliant. So we are addressing that challenge as well. We have two risk registers, Chairperson, both operational and strategic one, to really identify and put mechanisms in place to reduce the risks identified at both levels. Thus far, Chair, in Q2, we sat down to review our risks, and then we appointed a service provider also to use the recent templates for us to populate those risks accordingly and show progress. So we didn't have any challenges here. The risk registers remain effective. We also did not experience challenges in terms of recruitment activities. I will talk to the appointment of senior persons in the CGE, how far we've gone in that. So we did not experience much challenges in Q2. The culture transformation plan, there is a progress report. Again, we are going to link this one to the corporate organizational strategy. We have reviewed 3 policies during the quarter, and this doesn't lead to any variance, so we've achieved what we needed there. And then there was also a training that was targeted, and we were able to achieve this without any challenges. We have used our television and radio and digital platforms to share the reports of the CGE. Again, we didn't find any deficiencies there. And we have defined organizational effective systems through our IT department. Our ticketing system, our intranet is completed, and our web infrastructure is something that we are currently addressing. So we didn't experience any challenges there. And then in terms of Q3, Chairperson, we're targeting in terms of outcome 1. Again, 5 legislative submissions. We did not experience any challenges there. We've made inputs into the Immigration Amendment Bill, the Marriage Bill, the Nursing Practice Standards, the UN Human Rights Council resolution on intersex persons, and the South African Law Reform Commission on persons with disability. In fact, next week we've been requested by the Portfolio Committee on Home Affairs to come and make oral submissions on the Immigration Amendment Bill following our written submission. So we did not experience any variance there. We had targeted 2 strategic engagements with the executive arm of government at the private sector. You will recall in Q1, I've indicated that we had to conceptualize and engage internally around the issues that we need to escalate as the CGE. And it was identified in Q2 that issues pertaining to in the institutes of higher learning, particularly on sexual harassment, continues to be a challenge. So in Q3, we have held a strategic engagement with universities on the 9th of October 2024, and subsequently also engaged the Deputy Minister of Higher Education on some of these challenges that we have identified. What is currently happening, Chair, is that there is a task team that has been established by the Deputy Minister of Higher Education to work with the CGE to implement the recommendations delineated in the report. One of the key issues that obviously come is that there must be those awareness sessions around sexual harassment and engagement with universities to make sure that the culture and practices are such that they're able to respond whenever issues pertaining to sexual harassment are reported. So that is something that we are quite happy with the support and participation by the Deputy Minister. We had targeted 3 investigations again in terms of reports. So in quarter 3, one of the things we have done is to engage the relevant duty bearers, particularly on Pillar 3 of the NSP, and this was done in the KZN province, wherein we have called the South African Police Service, the NPA, amongst others, to respond in terms of what they are doing to ensure that they address challenges pertaining to gender-based violence and femicide, an issue which, in terms of the briefing note, is also linked to the State of the Nation of address by the President in 2024 of the need to make sure that institutions respond effectively when it comes to the gender-based violence and femicide. So we called these institutions to determine what are they doing, what are the gaps, and how far are they in terms of putting measures to address those existing gaps. To make sure, Chairperson, that we leave no one behind as per the Maputo Protocol, as well as the NDP in the country, we have called a hearing in the Gauteng province where we have looked into the empowerment of women in the informal sector, which was held on the 25th of November 2024. Equally, on the 28th of November, we have held another hearing at the Northwest Province to look at land allocation by traditional authorities in terms of customary law. And we've been trying to ascertain how consistent are those processes, and that women in the main, we hope, they're not going to be discriminated. But we've also identified areas that even males who are unmarried are excluded in terms of owning land in some of the areas in the Northwest. We've agreed with the Royal Bafokeng Council as the responding party in this regard that we will do inspection in logos in terms of some of the work that they are doing to ensure that persons are not discriminated unfairly on the basis of their gender. We were concerned, of course, that the view that you must be married for you to occupy land, it's a discriminatory practice which we'll continue to address across all provinces, Chair. And then in terms of 1.4, we met our targets in terms of complaints handling processes, and then there are no variances in that regard. In terms of 2.1, we had targeted 18 gender mainstreaming sessions. We have 1 positive variance. We did 19 of those during quarter 3. And then in terms of 2.2, where we had a target of 27 gender equality education information initiatives for dissemination, both the public and the private sector, we did 59 of those. Again, there is a positive variance of 32. And one of the contributing factors was the key calendar events, including the 16 days of activism against the abuse of women and children, and the International Day of Persons with Disabilities, as well as the Men and Boys Advocacy during the month of November. So because of those key calendar events, we ended up overachieving in terms of our targets. Again, Chair, our view is that we have a constitutional mandate to disseminate and share information pertaining to the work of the CGE and various areas of gender equality. So we could not turn down some of these invitations because our targets are met. So we believe that the positive variance is therefore justified. In terms of 2.3, we had targeted 27 outreach initiatives using radio to educate. We achieved 39 of those, therefore leading to a positive variance of 12. Again, here, Chairperson, some of the collaborations, we did not spend a penny. It was as per the invitation, and we felt that we must honor such invitations. The more people we reach around the work of the Commission and the gender inequalities that exist both in the society and in the workplace, we must capitalize those so that we can address those challenges. We had targeted 9 gender and development training programs. We did 12 of those. Therefore, there is that positive variance. In terms of 2.5, our target was 27 content development initiatives for communication platforms and technologies to amplify the mandate of the CGE. We were able to do 52 of those, and therefore we have a 25 positive variance during the quarter. We had targeted 9 stakeholder engagements on critical gender issues in provinces. 14 of those engagements took place, therefore having a positive variance of 5. In terms of outcome number 3, excuse me, we pertaining to research reports. Our focus is on the gender-based violence and femicide index, again, as well as the experiences of women farm workers, women's access to criminal land, as well as the elections project. So data collection was concluded during quarter 3, and therefore the report writing will commence and to be finalized during quarter 4. In terms of the data collection and report write-up pertaining to the CEDAW report, again, there are no variances there. The data collection and data analysis was done, and in quarter 4, we'll commence with the final report to be tabled. We held 1 policy dialogue with institutes of higher learning, particularly on sexual harassment institutes of higher learning, and we don't have a positive variance there. What clearly came out of this engagement is that we need to have consistent, defined systems across all institutions in terms of how sexual harassment is being handled. And we believe that the Department of Higher Education is coming on board in terms of assisting with that. But the awareness sessions have commenced, as I've indicated. So we hope that all these interventions will lead to environments that are not discriminatory against any persons due to their sexual orientation, sex, or even gender. We target 1 engagement to share such research reports to stakeholders. 3 of those were done. Therefore, there is a positive variance. So because we've been engaging a lot in the media, Chairperson, we saw a whole lot of invitations for us to share some of our reports, and we could not turn down again those invitations. It was important that we share. We've met our targets also in terms of the research and monitoring reports using our X-Space, our CG website, our infographics. In fact, in quarter 3, we've held our first engagement on our X-Space just to disseminate some of the work that we are doing, and it was quite a success. And then in terms of outcome 4, Chairperson, the target again was the finalization of the draft organizational strategy. Progress there is that we were able to appoint the service provider to submit the draft organizational strategy. And then we believe that in quarter 4, we will be able to finalize this and start with the necessary implementation. We did not experience challenges in terms of our management committee meetings, so the targets again were met there. In terms of 4.3, as I've indicated, linked to 4.1 in terms of organizational strategy, the independent service provider was appointed and will guide how these 2 areas are going to be linked together, because they must talk to each other so that we are able to have a greater impact in terms of the strategy. The CFO will talk about the quarterly expenditure on planned and improved initiatives. Again, on the audit and action plan, we are on par in terms of reducing the audit findings. One of the things that, of course, was flagged in the previous committee was the need for us to to respond on the investigations pertaining to the fruitless and wasteful expenditures. We were able to appoint the internal audit firm that is currently assisting us so that we can finalize the fruitless and wasteful investigations. As soon as we are done with the investigations, Chairperson, only then we can implement consequence management. The AG has been raising this issue, and our view is that until we are done with the report, we will be embarking on arbitrary process if the report is not completed. So we are anticipating the internal auditors to finalize that investigation mid February, and then we will be able to respond there. I think this is one of the areas that has been long outstanding and flagged in our Auditor General's report over the years. So we are hoping this year we'll finalize this issue. On the progress on the compliance universe, we did not experience challenges. I've reported that we've been assessed by 2 institutions in Q1, and in Q2, we're just amplifying the level of compliance in as far as POPIA is concerned. We have our information desk, our PIA manual is on our website. The PIA guides as per the information regulators again are also on our website. The information officer as well as the deputy information officer have been registered with the information regulator. So we are on par in terms of compliance pertaining to those 2 pieces of legislation. The risk registers also, Chair, we have updated those as per the discussions in Q2. So we continue to have these risk registers without any challenges. In terms of recruitment, the subsequent slides, Chair, will talk about the status in terms of vacancy rate, but we don't have any challenges in terms of meeting our targets there. We have a progress report on culture and transformation, and we don't have any challenges again there. We have reviewed policies there, and this again, it was not a challenge. We were able to meet the targets with the assistance of commissioners to approve the status of policies in the workplace. And then we had one training and development initiative. This was done during the Q3 as well. We didn't experience any challenges again in terms of digital media platforms, using digital newsletters as well as social media platforms and live streaming initiatives. All our hearings were live streamed, and we were able to get a reach in terms of participation. So there are no challenges there. As well as the IT, as I've indicated, the ticketing system has been completed. We've started with the training of staff on the usage of the ticketing system, as well as addressing the WAN infrastructure. And the internet system, as I've indicated, it has been completed. Now, the issues that are emanating from the Q1 chair, I've spoken about this, that in as far as fruitless and wasteful expenditures, we are anticipating the report from the internal audit. As soon as we receive this, Chairperson, I will be in a position to implement consequence management as informed by the report. So we would be able to respond to this issue. And then in terms of the current staff complement in the CGE, we are having 12 positions at level 5, 1 currently at level 6, 14 at level 7, 4 at level 8, 20 at level 9, 9 at level 10, 13 at level 11, 2 at level 12, 2 at level 13, and 15 is 1. That is currently the staff complement of the CG, and of course we have 11 commissioners. The current vacancies, Chair, is the head of research. We conducted interviews on the 3rd of December 2024. The head of legal services, again, we held those interviews on the 4th of December. The member of audit and risk committee, we held these interviews on the 3rd of December. The legal officer, Free State, these interviews were held on the 13th of January. The offer was made. Similarly to the head of legal, the offer was made. The accounts payable clerk, interviews were held on the 24th of November 2024, and offer was made. The COO, Interviews were held on the 3rd of November 2024. However, due to the request by the COO for negotiations in terms of remuneration, we don't think we can afford the amount that the COO seeks from the commission. Therefore, we will be re-advertising this position as well. Similarly to the head of research, we were not able to get a good candidate for the position, so we'll be re-advertising that position as well. The provincial manager, Northern Cape, the shortlisting is planned for the 6th of February, that is the day after tomorrow. And the office administrator, Free State, the interviews were held on the 21st of November 2025. And what we are saying there, Chairperson, is that we are not going to appoint for the sake of appointing until we are satisfied that we have met, the standard that we have set for ourselves. We need a solid, unimpeachable candidate in senior level positions who will hit the ground running and be able to take leadership in terms of the specific departments, both research as well as the legal department and the COO. So yes, we understand that there may have been a delay, but we felt that the delay is justified because we just didn't get what we were looking for as the commission. The positions that have been filled is that one of the CEO, the PA to the chairperson, the PA to the CEO, three assistant directors in policy and research, assistant director finance, the receptionist, as well as the education officer in KZN. And there hasn't been any dismissals currently in both quarter 2 and in quarter 3. However, few written warnings were issued as part of consequence management. The contracts that ended include those of interns as well as the temporary driver. We have actually appointed a new driver who started on the 6th of January. In terms of the NDP as well as the SONA priorities as per the guiding document, Chairperson, I've indicated that we have held hearings, Chairperson, in the Eastern Cape as well as the KZN and Mpumalanga provinces to respond to the challenge of gender-based violence and femicide. And these hearings, as indicators, one was formed on the basis of concern of the withdrawal of cases in Mpumalanga and the TCCs and challenges emanating also in the institutes of higher learning, particularly on sexual harassment. Earlier on, I also highlighted the hearings that we held in the women's economic empowerment, particularly in the informal sector. In terms of our research initiatives on various socio-economic issues to inform policy and program, we have barriers again to access communal land as we see as an opportunity, Chairperson, to make sure that the land can be used for safety concerns, but even cultivation in some of these instances to ensure that the socio-economic statuses are addressed or issues are addressed so that no one is left behind. The monitoring of international instruments, that included that one on the Beijing Platform for Action and the CEDAW. And we have monitoring and awareness initiatives aligning to social cohesion, the gender-based violence and femicide, the inclusion of the LGBTIQA plus persons, and economic empowerment. And in 2023-2024, Chair, we have released or produced a report on the country's compliance with the Beijing Platform for Action. And the tool itself aims to establish a basic group of priority actions with the objective of empowering all women. In terms of the new Beijing Platform for Action, Chairperson, one of the guiding prescripts is goal number 5 that deals with gender equality. So all the work of the research department in as far as the development of research are informed by goal 5. And we do believe thus far it demonstrates the challenges that the country has in terms of achieving goal 5. And this is a reflection of what needs to be done by all the duty bearers in the country to make sure that we are able to adopt first and foremost prescripts that talk to goal 5, address issues of communal land that do not promote gender equality, the challenges in institutes of higher learning on sexual harassment. Again, we believe that sexual harassment is a barrier towards transformation in the workplace. What are the key successes and challenges as per the briefing note? Chairperson, we participated in the 81st Ordinary Session of the African Commission on Human Rights and People's Rights, and we submitted our first activity report and engaged in such discussions, and this took place in Banjul in Gambia. And additionally, the department attended the first African Women Land Professionals Association Conference in Dar es Salaam in Tanzania, where we shared some of our reports there. As you know, we have been part of the team that has been supporting one of the matters in the European Court of Human Rights, particularly to Caster Semenya. We are currently waiting for a judgment in that matter. We have held a successful conference, Chairperson, in Q2 on the 30 years of gender equality in South Africa. This was held on the 11th and the 12th of September 2024, and it highlighted the historic overview of the Commission's formation evolution over the years, including the key milestones and achievements in promoting gender equality. And we have interesting resolutions coming out of that conference, which will spend a considerable amount of the year 2025 looking at how we are going to address those so that we are able to provide feedback to the stakeholders. And of course, we've also launched two reports during the Q2, one on the access to criminal land as well as the state of maternity in the Eastern Cape. So these are the key highlights that we can safely refer to during the two quarters in question. What our challenges, Chairperson? The challenges, of course, it's around our funding, Chairperson. We believe that if we were to receive adequate funding, we will be in a position to make greater impact and reach in terms of the work that we do as an institution. As we previously indicated, Chairperson, we do have a business model, that business model that requires about 50 million or so for us to say that we are able to participate effectively as the CGE. But nonetheless, we've developed what we call a funding strategy through the Office of the Chairperson. And the funding strategy, of course, recognizes the low funding issue that restricts our ability to conduct more program-matic and extensive monitoring, education, and information programming, and expanding the policy and research work as per the constitutional mandate. So because of poor or lack of adequate funding, Chairperson, we flag that as the key challenges that we can say it remains a consistent issue during the quarter. Ideally, Chairperson, the full implementation of the model would result in the growth of the CG as well in provinces, where we would have district offices amongst others, so that we can address, or rather regions, so that we can increase the footprint in all areas of each province. Chairperson, that is the presentation in as far as Q1 and Q2. I'm not sure if I should then move to the learner pregnancy one, or you'll guide me, Chairperson. Thank you.
Yes, let us proceed to the learner pregnancy report. Thank you so much for that presentation.
Thank you, Chairperson. We have a very progressive research department, and one of its functions, of course, is to look at various research agendas in the country and areas that we need to focus on in the commission. And they've done an excellent work in terms of the study titled School Dropout of Adolescent Girls During Pregnancy and in the Postpartum Period in Selected South African Provinces. The research report provides the following background, Chairperson, and it revealed that only a third of adolescent girls who become pregnant in South Africa return to school, with each year that passes after giving birth decreasing the chances of ever returning to school. The research also shows that pregnancy is amongst the causes of school disruption, at particularly the secondary level, and that in many cases, the birth of a baby marks the end of schooling for adolescent mothers. A study conducted by the Human Sciences Research Council showed that more than 60% of pregnant teenagers did not return to school after the 2 years previously enforced by the Department of Basic Education. Therefore, the CGE conducted this study to make a meaningful contribution to the body of knowledge relating to the factors that influence pregnant learners and adolescent mothers to not to return to school, and to make policy recommendations as well as fulfill the constitutional mandate. And we are able to identify that the following factors lead to teenage pregnancy. This includes knowledge, access, and the use, lack of parental involvement, socioeconomic factors, statutory rape, older sex partners, and teacher-scholar sexual relations, including also substance abuse, individual factors, household factors, school-related factors, knowledge of relevant legislation and policies on handling learner pregnancy and the retention of learners in schools. During the study, Chairperson, the participants expressed the fear of being stigmatized and the preconceived healthcare workers' attitudes as a barrier. The adolescents feared using contraceptive services provided through the mobile health clinic in schools, but preferred using the fast lane contraceptive option available at the local clinic, given the privacy or the secrecy that this option is presenting. So, of course, here then you look at the stigma, Chairperson, and the need for one to provide to preserve their dignity, and then not stigmatize accordingly. The Department of Health Fast Lane Contraceptive option offered scholars the opportunity to bypass long queues at clinics. This afforded scholars the opportunity to return to school faster after receiving the contraceptive services. It must be noted, however, that in provinces such as the Eastern Cape, parents pushed back against the presence of mobile clinics in schools, claiming that the availability of contraceptives ignited early sexual debut. Then, from the study, Chairperson, we concluded that long outstanding issues of inadequate and distorted knowledge, as well as poor and inconsistent uptake of contraceptive, amongst others, is still a challenge. The CGE further concluded, alongside various other forms of support, parental involvement and support are key in the prevention of adolescent pregnancy, as well as the reintegration of pregnant girls and young mothers back into school. The CGE concluded that the practices employed in the management of learner pregnancies across the schools in the provinces visited for the study remained incoherent and staggered despite the government's introduction of the national policy on the prevention and management of learner pregnancy. Finally, efforts to provide training, capacity building, and policy awareness by the Department of Basic Education were fragmented, resulting in inconsistencies in the application of policy amongst the provinces. Now, Chairperson, we, as this Chairperson of the Commission indicated, we have developed a different way in terms of how we deal with our reports. And we are not just going to present this report, but we present these to various key stakeholders through our policy dialogues so that there can be an element of accountability, monitoring, and evaluation. So subsequent to the publication of this report, we have held a number of stakeholder engagements in the Eastern Cape, KZN, and Limpopo during September 2023, as well as the provincial departments of basic education were invited, and we had to deliberate on the key issues emerging from the findings of this study. And we've also appeared before the Portfolio Committee on Basic Education to really discuss the findings of the study and the measures that the Department of Basic Education is going to embark to respond positively towards the implementation. And we've highlighted a number of issues, as we know: sexual misconduct, forced marriages, violence against girls, especially in rural areas. And we've stressed the need for a realistic assessment and concerted effort from various stakeholders. We've also, on the 5th of March, appeared before this Portfolio Committee to reflect on the report as it was published, but we did not provide, of course, the progress which we'll be highlighting today. So on the 5th of December 2024, we held a strategic engagement with the Department of Basic Education pertaining to this report. And the purpose of the engagement was to ensure accountability for the implementation of the recommendations. So the first recommendation, Chair, as you know from the previous report, was a comprehensive approach that incorporates awareness raising amongst parents, educators, and broader communities about the importance of open communication about sexual harassment, sexual and reproductive health related services. Subsequent to this recommendation, the DPE indicated that through the UNESCO and the UNFPA, they have developed a curriculum aligned material on parent-child communication, PCC. And they have subsequently held dialogues, four of those in the Eastern Cape, Free State, Mpumalanga, as well as Limpopo province. Furthermore, the ministerial early and unintended pregnancy dialogues were conducted with learners by the deputy minister, and a total of about 1,000 of learners were reached during the process. We have recommended that there must be a provision of comprehensive sexual and reproductive healthcare services by adequately trained and healthcare practitioners. The response we got was that through the state-led integrated school health program and other supplementary projects implemented through the support of the South African National AIDS Council, development agencies, and civil society organizations, services are by standard procedure provided by adequately trained healthcare providers as prescribed in the integrated school health policy and the standard operating procedure for provision of sexual and reproductive health care services in secondary schools. We've indicated in the report that there's a need to have strict law enforcement against teachers involved in sexual relations with learners and cases of statutory rape. The progress provided was that the protocol for the management and reporting of sexual abuse and harassment in school currently guides the work of the Department of Basic Education in its efforts to address school-related gender-based violence. The protocol provides a standardized response to the management and reporting of sexual abuse and harassment across the basic education system. Further to that, Chair, we informed that there is that collective agreement that was signed in 2018 largely by trade unions, providing for compulsory inquiries by arbitrators in cases of disciplinary action against educators charged with the sexual misconduct in respect of learners. The sexual offences register chairperson, we have read that is going to be publicized in the next week or so, end of the month. As the CGE, we welcome that. We welcome it from a perspective that, Chair, if we don't have access to the register, we do find that perpetrators of violence against learners in school, they still find that they are somewhere within the basic education systems. So we believe that once that register is published, Chair, it will help us and even help the department and even other departments, quite frankly, so that those that are found to have committed offenses of this nature are not employed to still work with children in that respect. So we are looking forward to see how the publication is going to work. We've recommended that educational programs against the use and abuse of substances by children is a key issue that both the Department of Education, Health, Social Development, and the South African Police Service must spearhead and address. As such, Chair, we were informed in terms of progress that the alcohol and substance use and abuse prevention and awareness is addressed through the curriculum in the life orientation and supported through awareness campaigns and screening conducted through the HIV and AIDS life skills and various partner programs in the basic education. In addition, a advocacy and communication program has been implemented. The DPE developed the national strategy for the prevention and management of alcohol and drug use among learners in school. This strategy is aligned to the National Drug Master Plan championed by the Department of Social Development. And what we welcome there, Chair, is that we realize that when it comes to abuse of substance by learners, it can't be a sole responsibility of the Department of Basic Education. There must be that concerted effort by the departments, including health, social development, and the South African Police Service. So we welcome the collaboration currently by these departments to really respond positively towards this recommendation. And we've seen that now awareness sessions have commenced in different areas, and there are drug testing kits in the Western Cape. There are awareness sessions and training taking place in provinces like the Northwest, which is as well as the Gauteng province, in as far as the anti-substance abuse and campaigns are concerned. So we are happy that gradually these departments are looking into how they can introduce mechanisms to curb the substance abuse, which is a contributing factor in this regard. We have recommended that more studies must be undertaken to unpack in detail the specific economic needs of pregnant learners and adolescent mothers that lead to the withdrawal from school. And we are happy, Chairperson, that we have one of our stakeholders that were interested in responding to this recommendation, to work with us and expand on the study so that we can look at these different specific economic needs of pregnant learners leading to their withdrawal from school. We do believe that once the concept note has been drafted, and if we can expand a bit on this, we are going to get more groundbreaking findings that will inform, progressive steps that are needed to really address the social economic needs. We have recommended that schools must create a positive learning environment by adopting values of empathy, non-judgmental attitudes, and emotional support towards pregnant learners. Of course, here, Chairperson, it requires the need to train and alert teachers and all the role players in terms of how we can still create an enabling environment, because pregnancy is not something that should be a barrier towards accessing education, or should be a barrier that exclude a child from going to school. So if we can have a values around empathy and understanding the causes that lead to teenage pregnancy, maybe, Chair, will have a different approach in terms of how some of the learners respond positively, notwithstanding their pregnancy, to come to school. Because we've observed in some of our matters, Chairperson, that in some of our schools where a learner comes pregnant, they chase them away to say, come with your parent. And that becomes one of those stigmatization that leads to the school dropout. So we do believe that we need to inculcate a culture of promoting equal rights and non-discriminatory interactions and practices in schools, so that we don't unfairly discriminate against learners that are pregnant. We have recommended that there must be a zero tolerance policy for bullying, and this must be adopted by school with a strong emphasis on anti-bullying practices against pregnant learners and adolescent mothers. And what I've just referred to is one of these issues where it amounts actually to some form of bullying or exclusion. But the Deputy Minister led the interdepartmental campaign that intentionally, deliberately added learner pregnancy as a prominent focus area, given the need to prevent any unintended pregnancy through general messaging against social ills impacting negatively on basic education and bullying that is often experienced by learners who unfortunately fall pregnant. So that is something that is currently impacting. But I must admit, Chair, it requires a continuous effort by the department. A single campaign is not going to help. It needs to be a continuous engagement, and all role players coming to the party in that regard. So both the Department of Basic Education and the provincial education departments have continued to capacitate schools on the National School Safety Framework, which enables schools to identify safety threats such as bullying in schools, and empowered to develop anti-bullying policies in schools. And we believe that these policies, Chair, will help in terms of dealing with learner pregnancies, drugs and substance abuse in schools as well. So these campaigns remain very critical, Chairperson. But as I've indicated, this must be continuous. As it is now, we know that they've commenced in the Gauteng, Limpopo, particularly in Sekhukhune East District, Mpumalanga, Ngangala District, as well as Northwest Dr. Kenneth Gauda District, as well as in the Eastern Cape. But this must be rolled out, of course, in all the 9 provinces. And that is why on recommendation number 8, the DBE conducted workshops with the relevant officials in 9 provinces to Cascade District and schools understanding when it comes to learner pregnancy in schools. And this was done on the 17th of February 2022. Roadshows were conducted in KZN and radio interviews were done in a number of provinces, including Mpumalanga as well as Northwest, to mention a few. So it continues to be an effort that is taken by the department. The department indicated that they printed and distributed about 19,000 copies of the policy to all 9 provinces for distribution to schools. Recommendation 9, Chair, is that the application of the national policy and the prevention and management of learner pregnancy be accompanied by programs that create academic support for pregnant learners and adolescent mothers in the form of catch-up initiatives and remedial education. The CG recommended that the department take up these initiatives together with civil society. Management of learner pregnancy guidelines made provision for academic support during pregnancy. However, the DB is also partnering with civil society who operate as sub-recipients of the Global Funds Adolescent and Youth Program through the Keeping Girls in Schools component, as well as implementing agents in the Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe project funded by USAID. So this the feedback that we received in terms of implementing the recommendation. But the policies, the chairperson, we acknowledge and we are saying there should be more. And with the recent announcements that were made by the United States in terms of the project, I can already see that this recommendation may also be affected by poor funding. And lastly, Chairperson, we are litigating in the Western Cape Equality Court in the matter of WM and others and Beaumont Primary School to really deal with discriminatory practices in schools. And we do believe that once that judgment is out, we would also set a good precedent in terms of how not to exclude learners on the basis of their pregnancy, gender, sex, and sexual orientation. Thank you, Chairperson. That's the end of my presentations.
Thank you so much, CEO. Can we move to the presentation by the Audit Risk Committee? I want to just ask the Audit Risk Committee to please just highlight or summarize the presentation for us. I want to allow members to have enough time to interact with these presentations. So if I could ask the Audit Risk Committee just to take 10 minutes to take us through that report so that we can hand over to members to engage. Thank you.
Thank you, Chairperson, and good morning to all the members. Good morning to the commissioners and also to the accounting officer and the executive management. If I may introduce myself, I am the chairperson of the Audit and Risk Committee. My name is Nkosini Mashabane, and I'm pleased to join with you today and share some of the key observations during the last 2 quarters pertaining to the work of the CGE. We are pleased with the progress that has been made thus far, especially the interventions which were effected by the commissioners in the positions of CEO, CFO, and new appointments that has been made that had improved one leadership and stabilized that. And this is reflecting in the manner in which performance has been realized over the 2 quarters. We note that in the previous 2 quarters, the performance had moved to an average 90% to 100% achievements across all targets. And this is it's pleasing, and we appreciate the effort and work that the colleagues are putting towards realizing this outstanding performance. We also note that in as far as matters of audit, just to talk to the key ones, which remains outstanding. However, I need to amplify the fact that in the presentation of the AGSA, they have given us a report which shows that in as far as financial statements and performance reporting, the work there was credible. There were no material corrections that had to be effected from the previous reporting period. And this is an improvement compared to prior years where the AGSA had to intervene to ensure that these reports are credible. But now there has been sufficient steps moving forward to ensure that the commission itself is able to produce credible reports, and this is something commendable. And on the matter that's outstanding regarding fruitless and wasteful expenditure, we steps taken by the accounting officer to undertake an investigation, as he has alluded to that. An internal audit is currently performing that investigation, and we trust that the conclusions from that investigation will assist the accounting officer to make a determination on whether to recover the fruitless and wasteful expenditure or to write them off. And also as far as irregular expenditure, whether there is a recoverable debt there or an application for condonment should be submitted. But something very key, it's how between the CFO and the AGSA, the communication is improved and there's better understanding now on the steps that needs to be taken and the framework that needs to be complied with in investigating and closing these matters. And the acceptance from the AGSA, the nature of evidence that's available at the CGE that will therefore be made available for them to audit and conclude on these matters. So we trust that this will be closed as early as possible. We also note the progress that's made around risk management and on issues of ensuring that the response to threats to the business of the organizations are continuously monitored. The executives are holding up meetings and they by a member of the audit and risk committee, who then impart reports to the audit and risk committee. The meetings are taking place. There has been few problems, but this is improving, and we trust that the strength of the committee will improve and reports will be brought to the audit and risk committee and plenary for further evaluation and assessment on the effectiveness of the steps taken to deal with these threats that are presenting themselves at the CGE. We also are aware of the funding issues that in real terms, the rent allocation from the revenue fund is it's becoming less sufficient for the work of the CGE. And this is eroding the ability of the CGE to acquire the goods and services necessary to advance the mandate of promoting, protecting, and fostering gender equality in our society. Something that's very, very important given the many events that are taking place in society and are causing so many of our fellow citizens, in particular women, to discriminatory practices, to violence and fencing. So we plead with the particular committee that the organization be assisted in any way how to improve on the funding so that this work is accelerated or advanced. We also submit that in the periods leading to 31 December, the financial management around the CGE has improved very well. We believe that the strength of internal controls are showing by now. However, we will get assurance from this once internal audit concludes all the, including reviewing some of the financial management areas, so we'll be able to get a good picture of whether the achievements that was realized in 2023-2024 is sustainable, and the controls are able to maintain that. On matters of compliance, there hasn't been any adverse findings that we should note at this stage, but we are pleased with the regular checks that the accounting officer put in place by developing a register of all the applicable provisions emanating from the applicable legislation, such as the PFMA, the PSA, and so forth. And these are tracked continuously as and when transactions are concluded, events occurs, or certain activities takes place. And the Audit and Risk Committee therefore receives reports and monitor whether there was compliance there. We also
Chairperson,
submit.
please be mindful of time. I'm sorry to interject.
Okay, so perhaps to bring to a close, Chair, thank you. We note as a last on our sections that the committee has had with the body of commissioners and the space that they've created for us to share our reports, to communicate our work to them, and also to make recommendations. And we are pleased with the progress that the accounting officer has made towards implementing some of our audit findings. Just to note, one is the matter around ensuring that there is a dedicated officer who will facilitate planning and reporting so as to prevent the recurrence of prior findings around the credibility of financial information, of performance information. So we're pleased that the accounting officer is taking steps to implement some of our recommendations, and trust that going into the future, this will be the case. So all in all, Chair, this is our reports, and we also thank this particular committee for giving us an opportunity to submit on the work that we've achieved and that which we have observed of the commission. I thank you, Chairperson.
Thank you so much to the chairperson of the Audit Risk Committee. Thank you for that presentation and the work that you are doing. Can I please ask if the CFO would like to just come in now with a short presentation before we hand over to members?
Thank you, Chairperson. I'll run through it quickly to make sure that we deal with time constraints. Starting with our presentation, I'm covering about 7 items, but briefly in plus minus 7 minutes max, as the presentation structure is before you. Going to how CGE is, then I'll leave that. CEO touched on it a lot. Strategic outcomes, we deal with 4 of them, and our budget as well as our reporting are linked to our strategic outcomes. So looking at Q2 of our report, we spent 43 million versus the 46 million budget, which equated to the 93% of the 6 months in question. And on the Q3, we have spent 72.6 million versus the 70 million budget, and that equates to 103%. It was a bit of a catch up from the 3% variance of Q2. Now in Q3, we have managed to close the gap. And it's good to note that National Treasury approved our surplus funds of 7.7 million, with an additional 3.3 million that we could use to fund new activities that we were constrained not being in a position to fund those excess activities. Looking at our expenditure, as you know that we report on cumulative for the whole financial year, our budget of 93 million. As at end of 9 months, we've spent that 72 million. And it's looking good that we'll be in a position to spend our budget in full come the end of March 2025. Our balance sheet item also reflects that we are in a solid financial position. As you could see that our cash and cash equivalent as at end of December was sitting at 18 million, and we still have to receive the three tranches in the month of January, February, and March that will report at the end of March. And we're still waiting for the 5 million that was gazetted in 2024 from Department of Women that we get from Treasury via Department of Women. We've done follow-ups and they have promised to pay it in the near future. With our cash flow, also it shows how we account for our monies received, money spent, what we've in terms of our cash and cash equivalent that is balancing to the balance sheet 18.5 million. The investigations in progress, internal auditors started in November, investigating the prior year's irregular, fruitless, and wasteful expenditure items. We've been in constant communication with them, providing all the necessary information they need. We've had various meetings, and we have a commitment that they'll finalize mid-February this year, and the after CO will be able to implement consequences management. Audit action plan during the auditing for 2023-2024, HT issued 42 findings, and out of the 42 findings, we have managed to resolve 35 audit findings, which equates to 83% as at end of Q3, end of December. The remaining 7 findings, which equates to 17%, we are busy addressing them, which are impacted by the internal audit investigations that is underway, policy reviews, as well as contract management. We've done contract management assessments for Q1 and Q2. Currently, we're busy assessing Q3. Thank you, Chairperson.
Thank you very much to the CFO, and let me also take this opportunity to thank the chairperson of the CGE, the CEO, and also the chairperson of the Audit Risk Committee for those presentations. Honourable members, it's now your opportunity, so you can start raising your hands. I just also would like to say, in response to the remarks made by the chairperson, that of course we understand the reason and we accept the explanation for the documents having been received late. But my plea just going forward in terms of us and our working relationship, that we respect members and ensure that those documents going forward arrives on time. And then also just with regards to the business model, we unfortunately, it's not just myself, but it's the entire committee who have not received copies of the business model. So when we talk about an underfunded CGE, we talk about the need for this committee to assist the CGE to enable it to fully live up to its mandate. We as a committee need to be taken on board in terms of the business model and also the funding model to fund this new business model. But I think maybe during our next meeting with the CGE in the next term, we could start our meeting by taking a presentation on the business model and the funding model for this business model, so that we are also taken on board in terms of what its aims and objectives. Because of course we as a committee want to see the CGE that is vibrant, that is robust, that is fully living up to its mandate. And we want to support you in that regard. But honourable members, it's now your opportunity to ask questions. If I can take hands. I see the hand of Honourable Mkonto, followed by Honourable Adams, followed by Honourable Spies, followed by Honourable Megan Chauke Aduenes, followed by Honourable Kanile, followed by Honourable Jasmine Peterson, followed by Doc Lehlape. In that order for now. Honourable members, please proceed. Honourable Mkonto.
Thank you, Chair. Good morning to you, Chair, honourable members, our colleagues, the staff, and our guests, the CGE chairperson and her team. Chair, we welcome the presentations. Quite informative and clarifies most of the questions that one had in mind. But Chair, there are clarity-seeking questions and comments that I would love to present. The On outcome one, the Customary Initiation Act that the chairperson presented about, and she made a remark that it is blind to, it is gender blind. I think we also have to look at the part of the people living with disabilities. I'm talking about this chair, taking it from what we have recently experienced in the Eastern Cape, where a young man living with disabilities was sexually violated during the initiation season. If in that act, we can also make inputs that will lead to the act not being blind to people living with disabilities. Chair, is another policy matter and is a comment. The access to communal land, yes, I agree. It's a serious challenge in South Africa, and it's good that the CGE has started with a focus on communal land access, because it has been years since the dawn of democracy that we had those challenges of women having difficulty to access land with these customary laws. But Chair, I think in the future we have to look at the access of land in general in South Africa, related to gender issues. Because Chair, my experience as a community leader is that, and my observations also, is that women of all races, can it be white, can it be Indians, can it be coloreds, can it be blacks, don't own land in South Africa. I think when you go around, share yourself, you see farms written De Beer and Sons, businesses written Naidu and Sons. What does that mean? We have to analyze those things with interest as members of this portfolio committee. But that is a discussion for another day, Chair. My question then, Chair, comes to the risk registers. We are told the service provider was appointed to populate the risks. Chair, are we outsourcing our risks or our risk function just by that service provider? Is that not a risk itself for us to outsource our risks? I was also having a question on the vacancy of the post, but then it was later clarified that it will be filled very soon. The assistant directors of policy and research, we are told they are appointed for 12 months. Chair, why are not they appointed permanently? Can we be given reasons why such a critical positions having individuals that will be appointed for 12 months? And if it's 12 months indeed, are their contracts renewable, or is just 12 months they have to go and then we have to start afresh and have new people altogether? The the issue of the on the pregnancy of teenagers, Chair, many parents, Chair, the on the subsection of substance abuse. There are parents that are complaining. I think we have to take this to the Portfolio Committee of Social Development, that the rehabilitation centers, when they send their children are ultimately admitted in those rehab centers, chair, they say you steal a teaspoon, or you just take a teaspoon without borrowing it, and then you are out of the system. And parents are complaining that, but we are taking these kids to those institutions because they are not mentally okay. But a slightest mistake that they commit, even not bringing drugs into the centers, they are being expelled just for arguing with another rehabilitation. So, Chair, I think we have to have a joint meeting amongst other topics that we have to discuss with the Portfolio Committee on Social Development. Is this thing of the public substance abuse rehabilitation centers? Parents are really, really frustrated. The last one, Chair, is the intervention strategies on teenage pregnancy. I see them to be most of them to be proactive. I mean, to be reactive. How can we change this to have reactive, proactive strategies? I'm sorry, Chef, for that. To have proactive strategies, because and Chair, most of the strategies, they seem to be blind to the fact that it takes two for one to be pregnant. We are focusing on these girls that are pregnant. I know that it's not only the boys at schools that are making those girls pregnant. There are other external factors. But then, when are we going to focus to even have intervention strategies that will include also boys? The last one, Chair, when is CGE going to embark on a mission to take this portfolio committee and the portfolio committee of cooperative governance and traditional affairs to Malawi? There is a traditional leader, a female traditional leader that is doing quite a good work there. She terminates forced marriages, and she's taking girls to school out of her own pocket. I think we have a lot to learn from that particular traditional leader. Thank you for the opportunity, Chair.
Thank you so much, Honorable Nkonto, for those inputs. And I think also the issues that you've raised, please do take a note of them for when we do engage with the Department of Social Development in this term. Honorable Adams?
Thank you very much, Chairperson. Am I clear?
You are very clear, Honorable Member.
Thank you very much. Please not to switch on my video because of the network challenges. Chairperson, and good morning to all the members on the platform. Let me start with my questions. The CGE report titled School Dropout of Condolescent Killed Girls During Pregnancy and in the Postpartum Period 2023 was discussed, Chairperson, in policy dialogues in KZN, Eastern Cape and Limpopo in September 2023. The Provincial Department of Basic Education were invited and the content were shared with them. The question is, what specific progress has been made within each province? How is the progress tracked within provinces, and who is responsible for this? The CGE also appeared in Parliament twice to discuss the report. The first meeting was with the PC on basic education on November 14 November 23. What were the key outcomes of that meeting? And chairperson, also on the 5th of December 2024, the CG held a strategic engagement with the Department of Education. What progress has been made since then in implementing the recommendations? Chairperson, also an interdepartmental campaign on the prevention of violence, bullying, corporal punishment, gender-based violence, learner pregnancy, drugs and substance abuse in schools. Was such a campaign successful? What is the CGE assessment of the campaign in this regard? Chairperson, once again, the DBE has conducted workshops with relevant officials in all 9 provinces to provinces launches this policy since 17 February 2022. Also, roadshows were conducted and radio interviews were done in provinces. Did this make a difference of what was conducted in provinces? What is the CGE assessment on these workshops? The department also, chairperson, distributed 90,000 copies of the policies to all 9 provinces. Have all schools receive a copy of the policy? How is the CGE assessment the rollout advocacy and awareness raising initiatives support and strengthen the application of the policy? And then, Chair, under quarter 2 and quarter 3, under litigation, how has the CGE resolved the matter with the Legal Practice Council and its standing as a legal entity? When will the CGE reinstitute legal practice clinics again? Chairperson, under strategic outcomes 2, 18 gender mainstreaming sessions. With whom were the other 18 sessions in quarter 2 conducted and what were the outcomes? And the other one, Chair, is under gender and development training. The CGE is to be commended for conducting 11 GAD training workshops. What are the lessons learned and how can this be replicated to other areas of work for the CGE? How many people attended the training and what feedback was received from participants? And under information and communication initiatives, the CGE is also commended for executing information and communication in. How successful were these initiatives and how was determined? There's another one, the strategy objective, Chair. Research projects completed. Who were the gatekeepers that CGE referred to the in quarter 2 report and why 6 months into the FYE? Also, again, on strategy outcomes for.
Just round up for us, Honourable Adams.
Yes, I'm almost done, Chair. Organizational strategy. Why was the strategy not finalized in quarter 2? And then policy review. Which policies were received in quarter 2 and 3? Audit action plan. What are the 7 audit findings that were being addressed or pending finalized. The last one, Chair. CGE is making to advance gender equality in the performance reports. What does the ARC propose the CGE do differently? What is the ARC expecting of the CGE? I thank you, Chair.
Thank you so much, Honorable Adams, for those questions and inputs. Honorable Spees.
Thank you, Chairperson. Am I audible?
Yes, thank you, Honorable Spees.
Thank you very much. First of all, Chairperson, I welcome the presentations and the clarity given on some questions that were um, pending or that I anticipated. I, however, have, I think, just four questions. The first one, Chair, is that I would like to know with reference to rural outreach initiatives. I want to understand, or if the Commission of Gender Equality can provide me with more details on its rural outreach initiatives, specifically those targeting farm workers. I want to know which geographic areas have been reached and what platforms or strategies have been used to reach this demographic, to provide support and to raise awareness. And then I also would like to know how progress have been tracked and who is responsible for ensuring that this progress is indeed being tracked. Um, just latching on to Honorable Adams's question, um, the issue with regards to the comprehensive sexual education program. Um, I want to understand how does this initiative intersect with the DBE's comprehensive sexuality education program, and are there any plans going forward? Because in many of what is said, Chair, there is not a lot of detail in terms of how the program is going to intertwine or intersect with the different departments that the CGE has had engagements with. It's said that there's been engagement with DBE and all other stakeholders, but sometimes it doesn't say what is the actual program or the actual action that has been executed, and that detail lacks. Then I would also want to ask if the CGE can provide a much more detailed progress update on the recommendations with regards to the comprehensive sexual and reproductive health care services. And while, Chair, we acknowledge the services are being provided by trained healthcare providers through the Integrated School Health Program and other initiatives, simply by stating the status quo doesn't indicate whether these efforts are indeed effective or if they have achieved the desired outcomes. And I would like the CGE to elaborate on the metrics used to measure the success of these initiatives. Have they encountered, Chairperson, any challenges? And what are the plans for improvement or scaling up of these services? Then, lastly, Chairperson, in terms of HR issues, it is noted, Chair, that there is a new position for a planning manager that was never communicated to us as a committee, or maybe I am incorrect. I stand to be corrected. And if you look at the top management, it looks like there is quite a bolstering up of top management. And one would just want to know, and if the CGE, the chair, can just clarify for us what is the role of this particular planning manager, and what is this person's responsibilities, and how is this going to assist the CGE in executing its duties more effectively and responsibly. Some of the other questions that I wanted to ask, Chair, has already been covered by Honorable Adams, so I will stop there. Thank you very much.
Thank you so much, Honourable Spees, for those questions and inputs. They are much appreciated. Please can I give the platform now to Honourable Megan Chauke Arduinis to ask her questions, please.
Thank you very much, Chairperson, and good morning or good afternoon to honorable members, support staff, and officials that have joined us, and compliments to the new year. Chair, I've been greatly covered by my colleagues and would like to made by CGE, but one would also like to raise an area of concern in terms of the segregated data. And I think this is very important for us to have very clear, defined, segregated data that seeks to give us an overview scope of where deficiencies persist and exist within the local communities. Especially when we speak about gender based violence, when we speak about teenage and learner pregnancy, and how we can address the systematic challenges that are there. I think once we have segregated data, and CGE needs to be the one to provide this to us as they collect the data, which as Comrade Spees has said, what are the metrics that have been utilized? And one would want to know what are the metrics that have been utilized to compile the reports and to collect the data. What was said by one of my colleagues in the beginning was to speak to the disability sector. And I think a lot of the time in the reports that we do find that would be targeting on gender based violence and femicide, that would be targeting on teenage pregnancy and sexual orientation and education, we have sort of I can say a blind approach in terms of the education that is then going to learners with special needs. Number one. Number two, it would be the impact, negative impact on learners with disabilities. And then lastly, it would be what has that resulted in? And one would want to find out, as part of CGE's intervention strategies and plans, how do we work towards mitigating these systematic barriers and challenges that persist within the vulnerable communities, such as persons with disabilities or young people with disabilities, and also the LGBTQAI plus. Because we must understand that in the LGBTQA plus, there's corrective rape, where we are finding young girls who are conscious and aware of their sexual orientation, having to be forced into corrective rape and falling pregnant. What is the intervention and support mechanism in place for that? What is the support and mechanism in terms of challenging or addressing sterilization that is forced upon young girls with disabilities? And additionally, as part of the roadshow that CGE had undertaken, one would really want to know what has been the outcome and what was the intended outcome. So we start with the intended outcome and what was the outcome ultimately from those roadshows, and how consistently should these be taking place? Programs that are once off and not continuous, but we've got learners who are moving from one grade to another, from one level of the teenage to the youth stage, not being sensitized and not having the opportunity to have access to these programs. Before I also end, it would also be on the Tutuzela centers in terms of addressing um, child pregnancy and learner pregnancy. What is the collaboration or the responsibility of the Tutuzela centers in terms of offering psychosocial support? In terms of providing, protective materials such as your condoms, and what is the collaboration additionally with the Tutuzela Center and CGE with the departments, so Department of Health, Department of Basic Education, and any other relevant department? One would want to really have an insight on what that collaboration looks like, the intended outcome, and also what are the set targets and deadlines for it. And then lastly, Chairperson, and I think Comrade Spees, or sorry, Honorable Spees, apologies for that. Honorable Spees spoke about the appointment of a new managerial position. One would want to have an understanding of, in this role that has now being developed or created within CGE, well, one would take an appreciation, but one would then want to understand who was then responsible for programs planning before this appointment was made, and what has been the handover process, and the person who, or the portfolio that was then responsible for this element, what then are they left with in terms of their responsibility? What does that look like holistically? And also, what is the expected outcome with this particular appointment? How's it going to improve the efficiency of CGE? And I think, Chairperson, and lastly, it would also be to say that what are some of CGE's, with the recommendations that have been presented, what are the bottlenecks that CGE has faced in terms of successfully implementing all of them, where we've got 100% successful implementation? Because I think the bottlenecks are the ones that we then need to really directly focus on in order for us to see any form of improvement on ensuring that CGE is able to meet its objective and mandate. Thank you very much, Chairperson.
Thank you so much, Comrade Whip, for those questions and inputs. Can I ask Honorable Kanile, you are up next.
Thank you very much, Chairperson. I'd also like to take this opportunity and welcome the presentations that we have received from the CGE. Chairperson, I do have a few questions that I'd like to pose. The first question is with regard to the quarter 2 and quarter 3 reports that we have received. There was a number of targets where the CGE indicated that they have achieved their targets, and some that were not achieved, but they worked on them. I wanted to find out if going forward it's maybe possible for the CGE to maybe advise what were the number of targets that were set, so that when they indicate that they have achieved the target, we'll have a picture of the number that they've achieved, and if they were not achieved as well, I think that will speak to the number. Maybe they'll indicate with the number if it's 1 instead of 4, or 3 instead of 4. And there was a mention also on the issue of withdrawal of cases of GBV, and an investigation that was done in Bomalana. CGE also indicated that some of their findings were the fact that the perpetrators or the witnesses, they find that some of them, they live closer to the border, and they just cross to the nearest country, and they are unable to get hold of them. What I wanted to find out on this one, Chairperson, is if the CGE was able to establish whether those persons are within the country legally, and where it is perpetrators, have they ever been apprehended, maybe granted bail, and it is after they have received the bail that they no longer participate or come to attend the court proceedings. Chairperson, another one that I'd like to follow up on is the issue on teenage pregnancy. I think we all should be concerned with the rate of teenage pregnancy we are faced with within our country. And we have seen in December, there's a number of young women that have given birth in various hospitals. While I acknowledge or applaud the action that was taken by one or two ministers, if I'm not mistaken, one of them was in Limpopo, where she asked that matter be investigated, and the father of the child was arrested because they discovered that it was a statutory rape. I want to find out from SCGE if there are programs in place where they create awareness or public education, so that if within the community we are aware that there is an older man that is sleeping with the underage girl, we report that person at that stage. I get a feeling that it is usually a little bit too late when the man is only arrested after the young girl has already given birth. because that is a process that can no longer be reversed because the child is there and her future is already ruined. But is there a program in place to ensure there's awareness and public education? I think that is all from my side for now, Chairperson. Thank you very much.
Thank you so much, Honorable Kanyile, for those questions and inputs. Honorable Jasmine Peterson, it's now your opportunity.
Thank you, Chairperson. Greetings, colleagues. Chairperson, I think I've also been greatly covered by our honorable members. I just have one question. When the when the report says the current work focuses on the support to be provided to teen moms to ensure they continue with schooling. However, this includes access to child grant, which might be relevant but not specific to teen moms. The question remains, what does the current work entail and what studies has the CGE proposed and is being pursued? Thank you.
Thank you so much, Honorable Peterson. Dr. Leklape, followed by Honorable Mabel.
Thank you, Chair, and greetings to all, to the late year, and thanks for the presentations. My questions will largely resolve about the challenge of too many departments and the challenge of funding. But the first issue is about right sizing of your staff. I see you have nearly 90 odd staff members, and you got 9 extra posts that you are looking at. Are we fit for purpose given our challenges for finance? Are we having the right size of staff? Because for me, it's like we creating cars with V8 engines when a 2-liter turbo car would do. And I ask that because of sustainability. We have all these questions about no money for programs at community level because all the money goes into too much government and too much structures. What is the CGE going to do about that? Can you come up with something that's innovative and leading in this country in terms of having a right size, tight, small bureaucracy that delivers? And should we be looking for structures that put funds in the community for the programs to be done rather than creating top heavy oversight structures where most of the money gets spent? We've referred to the issue of the National Drug Master Plan. And one of the problems that we see on the ground is the lack of coordination and the fact that we have too many ministries: health, social welfare, and there's no coordination. I go to clinics and I find cancer patients that have to arrive at 4 a.m. for treatment at Charlotte Matleke Academic Hospital, and they have no access to food for the whole day. They have no access to social services because those reside elsewhere. Temporarily, someone will be put there, then someone is removed. There's no funding for social workers within health. When you talk about the National Drug Master Plan, when it comes to treatment, rehabilitation, there's no coordination between the two ministries. Should they be consolidated? Should it be health and welfare services or health and social services so that we get coordination? When things lie between two ministers, it creates problems. The third question comes from what was stated about the challenge of teenage pregnancy, where a pregnant girl child will be told by the school to come with a parent. How do we involve society and families in this issue? Because you can't have the schools and government sitting on one side and they are not engaging the community in terms of how we're going to work. Because if you're pregnant and you're not terminating, your home and your parents are important in terms of what happens going forward. Where's that coordination occurring? I know we have rules that say when you terminate, your parents don't need to know. But clearly, if you're going to keep the pregnancy, the parents need to be involved. How do we balance the issue of rights and responsibilities and teach our children the correct things? There shouldn't be this barrier between home communities and institutions. Related to that, I'm glad that you have a research unit. Would there be research done about the demographics of teenage pregnancies, incidents in the different communities that we have, amongst Africans, amongst colors, among Indians, among white? Incidents about economic strata, the rich, the poor, so that we can begin to find out what are the causative factors and begin to address those. We speak about some of the programs that are supported by global funds. We complain about wanting to be decolonized, but we're happy to take colonial money to fund basic services. Where's the sustainability going to come from on these issues? Because when America pulls the plug, even others are going to pull the plug. Because America supports even those that support us. Where's the discussion about us funding our own legal mandates and not waiting for outside people to fund our legal mandates? So for me, I would like us to look at those critical issues. And lastly, on the APP, I'm glad that there are many areas where you've done well and areas where you've overachieved. When you reset the new APP, I hope you'll address the issue of setting lower standards so that you can do 100%. That if you've overachieved, we hope the normative standard in that area of overachievement will take into account the fact that you overachieved, hoping that your overachievement was not a once-off. That should be the level at which you perform. How do we reset performance target so that they are appropriate? They are not very low so that they can be achieved, and we're testing ourselves in terms of what we achieve. Thank you, Chair.
Thank you so much, Dr. Klape, for those inputs and questions. I see also the hand of the Honorable Mabel. It's now your opportunity.
Thank you very much, Honorable Chair and members. I would like to welcome the report. The report sounds very good, but without any specifications. I think it's very much important when you report, you specify, especially on gender-based violence and teenage pregnancies. Two, the rate of teenage pregnancy it's worrisome. I just wonder because in schools, in the curriculum, there's sex education. I just wonder, Honorable Chair, what is it that it's being taught in that subject exactly? Because since the subject was presented, it sounds, it looks as if the rate of the teenage pregnancies it's becoming very high. I would like the committee maybe to investigate what is it entailed in this sex education that it's being taught at schools, because really we have to investigate and check in their curriculum, especially in this subject. What is it exactly our children are being taught? Thank you, Honorable Chair.
Thank you so much, Honorable Mabel. Before I hand back to the chairperson of the CGE just to coordinate all the responses, I've also just got a couple of quick questions that I want to add to the list. I wanted to ask chairperson and CEO, considering the gender-based violence crisis that we face as a nation, previously, we had seen that commissioners were conducting oversight visits at police stations and shelters. I just want to get clarity whether these oversight visits are still happening, and if not, why not? I wanted to also ask, linked to the issue of oversight and the responsibilities of commissioners. Since producing the report on learner pregnancies, have we had commissioners who are responsible for specific provinces interacting with schools where learner pregnancies are prevalent or on the rise? And I'm asking this because when we look at the issue of learner pregnancies, depending on the age of that learner, it is statutory rape. And somewhere the system is failing our children because, as Dr. Leclape had mentioned before, we've got all these trained social workers who are sitting at home, who are needed at schools. So it means that these children have not got the support of their communities. They do not have the support of their teachers, and in most instances, they do not have access to social workers. So, have the CGE played any role in terms of interacting with schools on a practical level to offer any support to some of these schools where we've seen the rise in learner pregnancies? I also would like to ask, there was a mention of the Beijing platform, and I wanted to check with regard to the upcoming CSW. What will be the roles and responsibilities of the CGE? Will you be hosting any side events? And what is the budget implications of this? I did ask with regards to the legal counsel that we get an update there, so that we ensure that the CGE is able to return to hosting some of its legal clinics. I did hear, however, that you are litigating against one school. It was in that report. So I just need to get clarity how you are able to litigate if the matter with the legal practice council has not been resolved. And I think then finally, I think the issue of the business model, if we're listening to members that are talking about the issue of a top-heavy management, the number of um, employees at the CGE, I think the business model, then the briefing on the business model becomes more important so that we understand where the CGE leadership want to take the organization, so that we've got a more effective, visible CGE. But with that said, I will hand back over to you, Chairperson, to take us through the responses, please.
Thank you, Honorable Chair. I will let the CFO and CEO respond to many of them, but I just want to respond to a few, and I think I'll start from the bottom up. The oversight visits, Chairperson, that you were talking about in hospitals were actually a program of that period. We have now got a program where there were visits to correctional services. There were hearings that were held with various people. That is why we were consulting with the various stakeholders through portfolio committees and others. So those visits were just but one of the many programs. It is done and dusted, and a report was submitted. So the report that you are going to be submitting now would be your visit to correctional services that we have done, and many other oversight visits that we have done. In terms of interaction with schools, one concerned, Chair, with due respect, that there's confusion because we presented one program that relates to teenage pregnancy, then the questions go there. That sort of is worrying me a bit, but I think the CFO will explain it more. Yes, last year we did a very successful side event at the CSW. We will be doing one again this year. The CGE over the last 2 years has actually been factoring into the budget that we request from the get-go the issues of Banjul, because we've got a reporting status there of an alternative report, as well as CSW. So we do have the budget, and the budget implications are not in any way grave. However, because of the success of our program last year, DECO has come forward and said we are prepared to sponsor you a room because you have to book that room and pay with the UN, pay in dollar rates. It is very expensive. And after last year, when we raised the issues of expenses, DERCO has actually come forward and said, please, we will be able to cover that cost for you. So that is covered, and it's not going to have a negative impact. Why I said I want to start on the other way around, because I also just want to touch up on the issue that has been raised by Dr. Letlape. Dr. Letlape, we can never be fit for purpose because there is only 90 people in the CGE to serve a 60 million nation. So we can never be fit for purpose. So it is frustrating when it's almost like, why are you looking at a VH when you should be looking at a 2-liter table? There are people out there that we feel that 2-liter tables, the impact will be bigger. They'll go a longer distance with less servicing on the way and less breakdowns. And therefore, those will be the people we want. Because now what we are saying here is almost like, let's have more people, or let's have, I didn't understand your question. Actually, let me put it that way. But the CGE, we have, unfortunately don't have a choice. Our mandate of all the C9s is the deepest, biggest, and most difficult. Our mandate, put crudely, says overhaul patriarchy, change everything in society as it has been known over 2,000 years, change it. And that in itself is a mammoth task. So we really have to get good people, or else we run the risk of being frustrated ourselves like we are. And when you talk about innovation, the fact that there are 5 people, 5 in each province, and we're able to do the work that we do with the limited, yes, yet impactful visibility that we were able to get. That in itself is innovation. We've been able to get airtime from SABC community radios, SABC mainline radio stations, TV stations, without paying because of our innovation. We've been able to collaborate with certain entities exactly because of that, our innovation. Right now, we have reduced our auditing fees from 6 million to 2 point something because of exactly that innovation, where we called our auditors and said, tell us how you're coming to audit us, let's get it ready. Give us a proper plan. After you've given us a proper plan, give us a break, go away, and then we get those things ready. You come in, you hit it, and out. We've reduced our audit to 3 months, 4 weeks, and then 6 weeks of auditing because of exactly that. We have been innovative. In each of our provincial offices, we've got an administrator and a receptionist, so that when people come, you don't have anybody there. We have been so, unfortunately, I don't want to use the word innovative because it is wrong. But we end up with a situation where in some of our provinces we lock the office so that all 5 go. We've got 1 legal advisor per province. You tell me, per province. So we've got 9 for 60 million people. We've got 1 education officer per province. So all this education that is being suggested, well and good, but please be aware, 1 per province. We then have 1, it's legal advisor, PEI, and something else, 3 professionals per province, and then the administrator, who then supports them. It supports them in terms of presentations and all of that, and then the person who sits at the office. All of them have had to undergo gender and development training so that they are able to help. So we are way beyond innovation. We actually are barely surviving. Our staff don't survive, but they do the work. All this work that we have presented today comes from 90 people serving a 60 million population. So I just wanted to to put that context. And then I'll go to the question that I was supposed to respond to directly in terms of bottlenecks and funding. We have serious bottlenecks. Number one, it is exactly the funding. Our funding is 90 million rands. 90. With all of this, 90. We have been so creative in the way we do it. 79 or something of that funding actually goes to program staff. So a good chunk of it goes to program staff. We are barely surviving in terms of administration. I don't know how many of you have actually come to Cornhill to come and see what we call head office and compare us to other, what you call. So we have stretched our resources, 90 without fail. Yet you have situations where small program would get 88 million, where we are getting 90. And then the other bottlenecks have got nothing to do with us, but how government works. Right now, we have got offices that are shocking, if we can take you there. What a pity Honorable Makaula is not in this group anymore, and Piri, because I would say let them tell you about the pathetic situation that they found 4 years ago in the Northwest. Up to now, Department of Public Works is running around this way and the other way and giving us reasons why they cannot do that. Then you have Department of Basic Education. We are supposed, I'm giving an example of the bottlenecks. We are supposed to give them, we're supposed to give them the responses like we're supposed to give all the other departments and every other sector of our society. You must remember our mandate. We're not like the public protector. We service each and every nook and cranny of this country. We also deal with private sector. We go in there and say, you are not transformed. We deal with all sorts of what you call it. But we have a situation where our own government departments are not following us. A typical example would be one thing. The teachers and who have been found guilty. Yes, they are doing something about it. But we are not getting the actual figures of so many teachers have finally been removed, etc. So the bottlenecks are there. But when you go to the community again, as Dr. Litlap was saying, where's the community in all of this? It relates to the question that was asked by Honorable Kanyile. We have got a community on the border of Swaziland and Maputo in Mpumalanga. The children there are being outsourced as sex workers to be raped by the truck drivers. And the families are the ones who are protecting, and they say it is cultural, it is something that they call funelaganelo. It's almost like Hushubediso, Chugutwala, and all of that. 13-year-old girls jump into the trucks in return for a plastic of groceries from Checkers. It is pathetic, but it is the families that are actually blocking that. Then when you follow the value chain where people are arrested, like the old men who were arrested and unfortunately died, the postponement of cases, over postponement ends up with the suspects dying along the way. And in this instance, I think I've mentioned it before, where someone died as a result of being HIV positive. So you can imagine a teenager who started sleeping with this man at 13 and ended up with 3 children. So it's a whole value chain. And then you have a situation when you say, SAPS, Mpumalanga, please come and talk to us. Then you have a situation where people say, what do you mean by this? What do you mean by this? I don't know whether it's called filibustering or what it is, and it's frustrating that we are supposed to provide oversight. We are supposed to be there to guide you after we've been out of the community and we meet all of these hurdles. All the things, no, not all, some of the things that you have asked us are things that other departments are supposed to be doing and coming back to you to give you feedback. And then you tighten the laws of the country. Teachers are supposed to be fired, but who's supposed to push them? It's the honorable members saying, let's do this. Teachers get fired And once they get fired, they must be withdrawn from the register of teachers, never to teach again. They must go on to the other register so that they don't come near children. But they change schools. So it's convoluted, and all of us, in so many ways, we are failing each other. You talk about impact. Unfortunately, all the impact you can afford, honorables, is impact of 90 people in a country of 60 million. But we are so proud of that impact as we speak now. The targets that we have set are not low targets. They're very difficult targets. But our staff go the extra mile. Our office is in Limpopo is in Polokwane. They travel up to Venda, the darkest corner of the country in Bay Bridge. That's where they travel. Our office in the Northern Cape is in Kimberley. They go to Portman's, somewhere on the border of Cape Town. Our office in Cape Town cannot even reach the border of the Western Cape, of the Eastern Cape. Eastern Cape, it's a life and death situation for those people who are traversing. So we're working under very difficult circumstances, very, very difficult. 90 million, 90 people, and nothing more. Dilapidated offices, and we are able to produce this work. So, Commissioner, honorable members, I just wanted to set that tone. We're not failing. We're doing the best that we could do under the circumstances laid out for us. I'll let the CEO take over from where we finished, but there's no ways we will reach where we're supposed to reach when each province has got one legal advisor, one education officer, and one researcher. We'll never be able to do it. Thank you. CEO, please, if you could come in there and be more specific, because I think honorable members asked for specifics. I was just doing.
Yes, thank you. Thank you so much, Chairperson. Thank you, honorable members, for the questions. I will request, Chairperson, that if I miss some of the questions, we are given indulgence to provide this in writing, if this is in order, because I think some I may have missed because I was writing down the notes. But on my records here, Chair, starting firstly with the customary initiation bill, to the extent that we must look at persons with disability, I note the comments. What I'm simply saying there, Chairperson, was that there are legislations that are passed often. And if we don't look at them from a gender lens, we are likely going to have unintended discriminatory clauses in some of this legislation, thereby emphasizing and highlighting the importance of the legislative submissions. The the act has been passed in 2021. I'm not aware if it is currently open for review for additional inputs. What I'm, however, aware of is that there is currently processes taking place in provinces like the Eastern Cape, where the provincial legislation must be aligned with the national one. And we ensured that the gender aspect is really included there as one of the discriminatory practices that must be adhered to at the initiation schools, which was previously not there. So it becomes important, Chair, that we understand what our role is there, but we don't have the control over what would ultimately be a legislation that is passed into law. We can only participate when comments, I mean, bills are open for comments in that regard. And then the issue, I think I note the comments in terms of access to communal land, that it should be looked at broadly. What, Chair, I would like to say here, and perhaps also looking at the study on teenage pregnancy, is that there's a certain limit, there are limitations to the studies if we look at our reports. We would have loved, in terms of access to communal land, to look at the broad exclusion or in terms of access to land, but we looked at the barriers that exist in terms of access to women in particular, and wanted to understand what are these issues. Similarly, the questions around the teenage pregnancy, Chair, I note there are vast questions that go beyond what we focused on for the purposes of our study. And of course, the questions remain relevant, but these answers are not going to be contained in our study because the study focused solely on the factors that contribute, these factors that contribute towards teenage mothers dropping out of school and not returning to school post pregnancy. And that is where I just needed it to be understood because, Chair, if we can start to look at other areas like why are we not focusing on the boy child, that's another area of study on its own that we said we have not engaged on, and it may require additional resources for us to look at the full spectrum that honorable members are raising. And I've indicated, Chair, that there is one of the stakeholders who was keen to say, you have taken as CGE this study up to this point, and we have said there is a need for more research studies in as far as this discourse is concerned. And this service provider said they would like to look at it as well from another perspective so that we can increase the knowledge and understanding of some of these barriers. So, Chair, we just wanted to clarify that our study is confined only to this and only to specific provinces. So we could not go for Western Cape amongst others. We could not go for from Mpumalanga as well, and as well as another province. So it's confined only to very few provinces because of the budgetary constraints that we have. We could not do a full spectrum. So I note there is a need, of course, Chair, to look at the boy child in as far as the study is concerned. What is their role? There's also room for us to look at the perpetrators. How are we really dealing with the perpetrators, those that impregnate teenage mothers? What are we doing? That is also on its own an area that needs further research, which we agree on. So questions relating to such, Chair, unfortunately, as I've said, they are not going to be covered by the study because that was not the focus area of the study. Now, what we have said, Chair, was that the report as produced details specific number of recommendations. And the report that we're presenting, Chair, is that recommendation 1 to 9 has been implemented by the Department of Basic Education. And largely what has been done thus far is the awareness campaigns that have been embarked on by the department, and they're embarked on because we have also said in our studies the lack of knowledge around some of the contraceptives. It is one of the challenges there. The issues around mobile clinics is also a challenge there. So there is that duty that is on the Department of Basic Education to roll out those awareness campaigns as the responsible department with the sole responsibility of ensuring that an enabled environment is created for all learners. It is within that context here that we are engaging the department to say how far are you and what are the challenges that you are currently experiencing. The CGE did propose to the Department of Basic Education that it should be invited to the curriculum group to make inputs into its curriculum development. This will close the curriculum gap that we have identified also as the institution in as far as sexual and reproductive health rights are concerned. So we must get reports from the department and we then provide guidance in terms of how to manage and navigate some of the barriers that they are identifying to us. So whether the advice is to the effect that we are struggling in terms of inculcating a culture of awareness to teachers, then we would recommend specific programs that this program ought to be there. This policy must be there so that we are able to enforce and implement what we are recommending. So it continues to be a journey that we have with the department. They are interested in going in a full spectrum to discuss the discourse and address the discourse, which we fully support. But we are simply saying from our end, Chairperson, it must be understood that our study was limited only to the factors that leads to school dropout, not necessarily all other factors that may be also critical that are contributing towards teenage pregnancy. We focus only on the dropout, Chairperson. There was a question around risk management and whether the appointment of a service provider on its own is not a risk. Well, Chairperson, we felt it's important to just have an independent person who will take us through the review process. So they were not generating risks for us. I think it's important that they were not developing risks for us, but they were merely assisting us to review the current risks that are contained in both the operational and the strategic risk. And that process was done. But what we've also concluded after the whole process was that actually we can start doing that ourselves, so that we can minimize the costs that are associated with this. So I just wanted to say that it was not a risk per se, but we wanted somebody who will help us to review the current risks. Because at times the risk itself may just be, we may be confined to what the business of the commission itself, but there may be other emerging issues that a third party may be saying, keep a lookout for some of these responsibilities. So that is why we got a service provider. But I think we've agreed as management that going forward, Chair, we can actually start doing this our own. We just need to start thinking outside the box and minimize costs in that regard. There was a question on the assistance directors. Chairperson, these are actually going to these are now permanent positions. We could not fill them until we were done with the business model. So we gave this for a period of 12 months, so that we are able to finalize our processes in terms of business model. So the business model is very much clear in terms of what needs to be done in terms of the filling of those positions. And we were in plenary, we've agreed that we can start with the process to fill those vacancies. There was a question on, I think this is just a comment to say we must have interventions that are not reactive, but rather more proactive. I agree, Chairperson. And that is exactly what the Department of Basic Education must do, because it is the responsible party. We are the ones who are conducting oversight and conducting research so that it can inform policy development in the departments, that it can inform practice directives in departments. And we believe that what the department has done thus far was just to implement the recommendation. But surely, Chairperson, there must be more. There was a view expressed here that we need continuous programs, not a once-off. We've agreed fully, Chairperson, that this must be continuous, because the department, unfortunately, it bears the responsibility of ensuring that necessary intervention strategies are put in place. We do say they are the sole responsibility, but there must be a concerted effort between the department, social development, health, as well as the South African Police Service. And in our presentation, we have tried to show how thus far these departments have collaborated so that they can now start to proactively deal with the emerging issues as they embark on these initiatives and campaigns to educate, enlighten, and enhance some of the existing systems there. The question on, I think this was just a comment to say there are lessons to be drawn in Malawi. I think we have just noted that, Chairperson. And then just checking this. So there was a question, Chair, on the how successful have these campaigns been, and then whether do we have a tool that we use to get feedback and so forth. Chair, we in our sessions that we have across the institution through our public education and information, we have a tool when we conduct sessions and we get feedback sessions around the importance and the efficiency and the relevance of the discourse what that is being shared by the commission. So all our stakeholder engagements thus far, it's something that we have developed because it gives us at least an inclination of where we need to be going as a constitutional body in terms of dissemination of information. And we do that, Chairperson, at various platforms, our X space as well, We are currently embarking on the Dumisa TV channel, where we'll be discussing emerging issues in the line of our work as form of a way of saying, let us communicate and educate, because that is part of our constitutional mandate. So we will be embarking that even this quarter, but in the previous quarter, if you look at our YouTube channel, our X Space, our website, our I forgot this other one. We just resuscitated it now. But we've developed a variety of platforms. Or the LinkedIn account. Sorry, Chair. The LinkedIn. We've started a program there as well. It's a communication channel as well, so that we can try to engage as much as possible as the commission, but also from the radio platforms, because we appreciate, as I've said, Chair, that not all persons in communities can access the CGE. So the radio outreach programs continue to be very vital in that regard. But as the chair of the commission indicated, one of the strenuous things, Chair, is the traveling of the staff members from one region to another, one district to another. At times it becomes risky as well. If somebody gets a puncture along the way, that is 4 or 5 hours from the office, the crisis now starts. We need to find a way to try to mitigate existing risks, that we don't also want our staff members to be subjected to any form of violence because of the nature of the work that we do. So those are some of the strenuous things that we have picked up as we embark on our operations. And then there was a question to say which province is doing what in terms of the geographical data for our studies, and how far have they got. So one of the things that we've highlighted in our study was, for example, the Department of Education in Limpopo was not cooperative with us in terms of the initial study. And even during the policy dialogue launch itself, they came and tendered an apology, but we could not get sufficient data because of the lack of cooperation. And when we did the consultations with learners, it was in the areas of Palabora, Makado, Zanin, Toyando. In the Eastern Cape was in Matatiele, KZN was Fuwe, Jozidi, and yes, these are the ones that we're able to focus on in as far as that study. And you will appreciate from the study, because we're engaging learners, which largely one must be mindful of issues of confidentiality. There was importance for us to ensure that we live up to that during the course of our engagement. That is why in our research studies, Chair, we did not really specifically mention who, but rather mention the areas and the issues that were highlighted. And then the DB strategies and what has been the progress, Chair, my view is that recommendation 1 to 9 as presented demonstrate the progress that has been made, and the intervention which the department is going to embark on to implement all the recommendations in all the provinces. We continue to have this engagement with the department so that we adequately get progress. There was a question on litigation. How are we able to litigate whereas we don't have a status? And also, what is the status of our processes? Chair, was advised that the legal practice bill has been approved by cabinet. You'll recall that we have indicated in the previous quarter that we've made our submissions, and the draft bill that we saw, it had sought to include the Commission for Gender Equality as one of the institutions tasked to embark on or to take on legal work. So we have made that submission. The bill has been approved by cabinet, and we are advised that we will be informed of the next steps pertaining to this. So it's a huge milestone, and we anticipate that perhaps in the new financial year, hopefully, this status would have been confirmed with the Legal Practice Council. And then, Chair, there was a question on let me make sure I got it right, on gender mainstreaming, Chair. We have done our gender mainstreaming sessions, Chair, with a variety of sectors, because we've moved away from individual institutions, but rather started to focus largely on the sectors. So the question around the 19 is that in Gauteng we had with Water and Sanitation Forum, the water boards, as well as catchment management agencies. With the public sector, it has been with higher education training sector and local government. And then in Limpopo, it was the public sector and higher education and training sector. And the private sector was the mining sector. And in Mpumalanga, again, we focus with the South African Police Service and the Forestry South Africa. In Northwest, it was Salga, Kokta, as well as the mining companies. In the Western Cape, it was Central Karoo District Municipality and the Nelson Mandela University. The Free State was the local government through COCTA, as well as the taxi industry. In the Eastern Cape, besides the public sector, it was the TVET colleges, as well as the Eastern Cape motor industry. And in the Northern Cape, it was the mining sector, and the public sector was Pukwane municipality. In KwaZulu-Natal was the KZN legislature that we did there. So those are the institutions that we engaged. And what are the lessons that we can draw from that? Chairperson, in our report, we are clearly indicating that gender equality or the attainment or the promotion of gender equality must be central to the activities of every institution. And we are happy that the CG as a constitutional body is tasked with the responsibility of ensuring that this materializes for all the public and the private sector. But we can only do that to a certain extent. That's why our gender and development programs becomes very much important, so that once we are done, they are able to roll themselves into the next phases and for the years to come. So we believe that, Chair, we have done an incredible work in that space. And the more they implement, the more they identify challenges in terms of their policy gaps and practices, and they quickly start to move to attend to those. Chairperson, there was a question around the demographics in terms of our outreach programs and where we have done interventions. For example, I will talk to Western Cape because I do recall that the honorable member asked questions particularly on this province. We met in Vredenburg where we had an outreach program. The George, Stellenbosch, Rosenville, as well as the Doms. That's where some of our outreach awareness sessions were held. There are questions, Chairperson, pertaining to the office manager in the office of the CEO, stroke the planning manager. By way of background, Chairperson, the planning manager or the office manager in the office of the CEO emanates from a recommendation from internal audit, subsequently endorsed or supported by the ARC, that we need to have a central person in the commission that deals with performance information, due to the fact that over the years, it would seem that when it comes to performance information and planning, we are not doing well. So we needed to have this process centralized with somebody who will do even a performance and management processes in as far as performance information and planning is concerned. So that is the crux of the office manager in the office of the CEO. And as I've said, this is something that was recommended by the Audit and Risk Committee report. But what we have done, we have subsequently approached plenary and requested that in the business model, we reflect this accurately in the new organogram, which was done. And I do believe that once you receive the report, you will see that the position indeed does reflect that there is an office manager in the office of the CEO. And we do believe that this intervention is going to improve the efficiency in terms of performance management, as well as monitoring and evaluation in terms of this. Chairperson, there was a question on the metrics in terms of the study. We've conducted a qualitative research study as far as the teenage pregnancy study is concerned, Chairperson. I've highlighted the areas that we focused on in terms of provinces, and the fact that because this included teenagers, we had to ensure that confidentiality is adhered to. So what I can just emphasize, Chair, is that indeed the progress has been made in terms of the implementation, and we are just monitoring the implementation. To what extent is it emerging issues coming out of the campaigns and so forth, and the other programs that the department is proposing. I think this was more of a comment that programs must be continuous. In terms of the TCC's chairperson, we did not find, we found that in the Eastern Cape, there was lack of understanding in terms of who bears the responsibility to ensure proper and effective functioning of the TCCs. There was a view from the NPA that because the TCCs are not legislated, it's not clear who takes responsibility. Therefore, when you have some of these deficiencies, it becomes difficult to point who must take responsibility, whether it's whether it's the National Prosecuting Authority, or it ought to be the Department of Social Development. So what was clearly highlighted here was that because of the lack of legislation, there are these deficiencies, and something which we said it cannot be, because this is something that the National Prosecuting Authority must take responsibility for. So as a result, some of the services are limited because there was that lack of understanding of really who takes responsibility. One of the things that clearly also was reflected in the hearing was that victims that go through, or complainants that go through the TCC's processes, and as far as their cases are concerned, they tend to handle the trials much better than somebody who was not taken through the services of the TCCs. Therefore, suggesting that the model itself remains critical and important tool towards ensuring that Section 35 of the Constitution is realized, and that a fair trial is conducted in a way that it restores the dignity of those that have been violated because of gender-based violence. So we have agreed that we'll continue to engage just trying to think the name of the gentleman, but the coordinator, the national coordinator, who's responsible for all the TCCs in the provinces, to really come up with a clear plan of action in terms of how they are going to deal and address those issues across. There was a question, I may have missed it, but a question in terms of our targets, not mentioning the numbers. What we did, we've just highlighted broadly, Chair, but our detailed report reflects which targets were not met and what were the causes for that. So if the portfolio committee is of the view that we should rather mention the numbers solely, I don't know, Chair, if it will be broad enough. And I'm saying this without knowing whether the question I got it right. But suffice to say, from our end, the report indicates that we have 5, for example, submissions that we have made, and below we mention the 5 that we're not able to mention in that regard. So if I missed the question, Chair, you will clarify me. There was a question on what have we identified in terms of accused persons, whether they are here illegally in the country. We were not able to ascertain that, Chair, because this was the explanation that the NPA provided was that persons that come that are witnesses and accused persons, you'll find that in some instances they are in the neighboring countries, but their status in the country, Chair, was not something that we have confirmed. Suffice to say, we are aware that there are some of these witnesses and accused persons that are employed in the mines in Mpumalanga. And in our stakeholder engagement letter by our provincial commissioner and manager, we've called even the mines to say, can you come and explain to us the processes of employing people here? Because if they're accused of having violated somebody, there must be a process that mines take as well, so that you don't find that these people continue to be employed in the mines and there's no intervention from their end, because we understood that there must be, again, that concerted effort, even by the mines, the employers. We've also written to the Mineral Council to say, can they start looking into this issue as well? Because the report we got from the NPA was that some of the people, the accused persons or witnesses, are within the mines, and we needed to get an understanding of processes that employ these people in the mines, so that they can be also that responsibility from their end. Sorry, Chair, I'm just checking. I think Chair responded in terms of the targets as far as innovation is concerned. I think, Chair, if I'm allowed, if I missed, oh yes, I think there's also something here. No, this has been answered. Chairperson, allow me to say that is the feedback in terms of the answers. If I have missed anything, Chair, I will be guided, and I'll ask for indulgence, especially if there are numbers involved, that we be given an opportunity to provide this in writing. Thank you, Chair.
Thank you so much, CEO. Honorable Kanile, I see your hand is up. Is it a legacy hand, or did you want to respond to the question that the CEO posed about the targets not met? Honorable Kanile? Okay. I think, honorable members, that brings us then to the end of our interaction with the CGE. I wish to thank the CGE. I wish to thank the chairperson, the CEO, the CFO, the commissioners and members for their robust engagement. I think also it's good news to be receiving such positive feedback with regard to the Legal Practice Council. I think with regards to the responses that were not given today, we will of course allow for you to give them to us in a written form. I think the deadline we can give you is possibly up until Friday, but you will have to indicate to us, because I know some of you will be traveling to SONA. With regard to some of the issues that were raised in the responses, as a portfolio committee, we are planning to extend our oversight responsibilities. And during this term, for example, we will be engaging with the Department of Education and with social development with regards to some of the issues that have been raised, in particular with regards to learner pregnancies. Chairperson, I also want to indicate to you that we will be visiting your offices, hopefully at the end of March. And I think some of the issues you are raising is critical, because we as a committee will not be able to understand your challenges if they are not raised with us, if we don't get a full picture of some of the challenges that you face. And I think also that's why the engagement that we will have with you with regard to your business case then should start to speak to some of your challenges, and it will also then give us comfort when we throw our weight behind your business case, that it will address some of your challenges. However, I want to just say, as we're going forward as a committee and the CGE, I felt that some of the responses, I want to just caution to say that when members are on this platform and they are engaging, they're doing so because they are passionate about the issues that they're raising. They are also representing their constituencies, and at no stage should their inputs be seen to be attacks or an assault on the commission. I think when they raise issues, it doesn't mean that they do not understand the work that the CGE is doing. And in that spirit, I really want to say that it's not an assault on the CGE, it's merely members giving their inputs and obviously wanting to be a part of this journey that we'll be walking with the CGE. Chair, I want to end where you started. You had indicated to us that this is a new CGE, a more united CGE, and that is encouraging to this portfolio committee, and we look forward to working with you throughout the year. And with that said, honourable members, I want to thank you again for your participation. I want to thank the CGE again, and I wish you all well. And for those of you who will be attending SONA and CSW, travel safe, and we will be in touch. And honourable members, while we say goodbye to the CGE, honourable members must please just stay online so that we can deal with a few internal matters. But thank you so much, and goodbye to the CGE.
Thank you very much, Chairperson, for the opportunity, and honorable members. Thank you.
Bye-bye, Chairperson. Thank you so much.
Bye.
Thank you. Thank you, CEO and all commissioners.
Bye-bye. Bye-bye. Bye-bye.
Thank you.
Bye.
Honorable members, are you still online? I hope so.
Yes, we are.
Thank
Yes,
you.
we are, Chairperson.
Thank you so
Yes.
much, colleagues.
We are here, Chairperson.
Thank you so much. Thank you so much, colleagues. I wanted to say, I wanted to just go back because of the struggles that we had this morning. We did not table the apology of Honorable Gasa. I also just wanted Mvaba to give us, before we say goodbye to each other, Mvaba, are you online to give us just an indication on how far you've gone in terms of securing some venues for us? And also in terms of the NYDA venue for the end of the month, whether you've been able to secure a venue. And then I will say goodbye to members. I just thought that that update is important.
Thank you, Chair. I would love to check if I'm audible.
You are, Mr. Ndumizweni. Please proceed.
Thank you so much, Chair. I think it's very important, Chair. Let me also call the honorable members and colleagues to start by apologizing for everything that happened earlier. It's something that was unforeseen, which I think that in future is something that we must learn from and take some lessons. Going to this part of our apologies, sir. As you said, it's Honorable Gasa, and I've just received a text from Honorable Khwekane, who has just left the meeting to join the PC on defense. So I said that will be brought to your attention, Chair. Coming to the issue of venues, Chair, it's a struggle, but we are trying so much. For example, we've got a meeting of 11th, 18th, and 28th, and also the 25th of March. With those meetings, Chair, we don't have good venues for them because we've given the Castle of Good Hope, which is the military base. But when we conducted a research, when we consulted with other colleagues, we got the information that the state of the venue is absolutely not good. And we also got the committee. In fact, it's a meeting room in the NSFAS building, and there are issues like catering with these outside venues. So what we have done, Chair, we're in the process of applying to get a venue from Taj Hotel, was closer to Parliament. All it will assist us to also deal with the challenges of transport. So yesterday we received quotes from the travel agent in order for us to proceed and submit the political application. But the quotes that they submitted had some errors. We then sent them back to say that they must make corrections. So we're expecting those quotes because at the same time we had to put some balance in terms of the members so that the application cannot be rejected. That's due to the fact that the venues that are outside Parliament are not conducive and are not in a good state to be used at all. So we decided that we must submit a political application to just go to a hotel. So we're waiting for those goals, which I assume that the political application will be submitted today for those 3 or 4 meetings. Coming to the interviews, Chair, we've got S12A for 24th, S12A for the 25th, and S12, S12, M20, M46 for the 26th. We don't have a venue for the 28th. Now, this is what happens, Chair, with these venues. Sometimes it's difficult to tell members on time, although it's important, because we keep on changing. For an example, with the venues that we have for interviews, I'm still engaging with other colleagues, that is, other secretaries from other committees, to say they must release venues. For an example, in this case, we've got an option of using M46, that is to swap with the other committees that are already been booked, the M46 venue, or we stick with S12A. Then on the 26th, we move to M46. But we're trying to do something consistent and uniform, whereby we're going to use one venue. So far, Chair, those are the venues that we have secured for the interviews. And for the 28th, I'm waiting for the secretary of the Standing Committee on Auditor General to come back. She promised that she will engage her chairperson so that they can have a virtual meeting and release the venue and give us the venue. So I think that's all, Chair. As I indicated before, that we are in the process of procuring the venues outside Parliament, and preferable. In fact, we think that church will be the best suitable venue for our meeting. And like I said, our aim is to make sure that all the political applications get submitted to the office of the chairperson tomorrow at the latest. That's all, Chair. I'm not sure if there's something that I'm missing.
Okay. Thank you so much, Mr. Ntumizweni, and thank you also for the apology to members for what transpired this morning. I must say it was quite a stressful morning, considering that I knew that we had such an important meeting to attend to, and then for members to be locked out of the meeting. But yeah, at least if we do have venues going forward, some of these struggles will be resolved. Please do try and secure the Taj for meetings. I don't want members to be going then to the Castle of Good Hope and then to the Nesfas building and then to another building. It means members will have to take buses and then shuttles. It's just not suitable. So let's just try and get the Taj venues, and then also for the interviews, I would prefer if we use one venue for the entire week. So if you can negotiate for that M46 for the entire week, it will be helpful. Also, just make a note, I want members to be able to come with shuttles from the parks. I have discussed this with you, but I want members to come with shuttles from the parks to the interview week so that they are not delayed by buses, which has been the case before. So just that. Members, I do know we've got minutes, but it can also be deferred to our next meeting. I know that we started late and now we are ending late. Is there anything else that members would like to raise at this point? Okay, nothing at this stage. Then I want to wish members well. We will see each other, God willing, on Thursday at the opening of Parliament at SONA. And thank you for your robust engagements today. It's really valued and appreciated. And we will see each other soon. Bye bye, colleagues. This is the end of our meeting.
Thank you, Chair.
Thank you, Honorable Spees.
Okay.
Thank you, Jasmine.
Thank you very much, Chair.
Thank you so much, Comrade Whip.
Thank you, Chair.
Thank you, Mama Adams.